Good evening. We're just, thank you for joining us. We're just letting folks in from the waiting room and working to get started. And we'll get started in just a couple minutes. So. It's my son, Patrick. He's 9, so he's out of the birth to age 8 range now, so. I'm going to pop up. Okay. We'll give it just another minute and then we will go ahead and do introductions and get started. Okay. Well, it's 6:02, so let's go ahead and get started. So we appreciate you joining us. My name is Janet McLaughlin, and I am the Executive Director of the Vermont Association for the Education of Young Children. And as you know, we're the Vermont's largest membership organization for early childhood educators, and we are dedicated to making sure that all of Vermont's children can benefit from high-quality early care and learning services. And we know that's only possible because of the talents and dedication of early childhood educators. And we also know that early childhood educators are doing that work often, almost always, without the compensation and benefits that would be appropriate for the level of expertise and the work that's being done. So with that in mind, Vermont AEYC has been exploring and advocating around health insurance for early childhood educators, especially during the COVID-19 pandemic, when we saw so many early childhood educators who are uninsured or underinsured still returning to the classrooms, returning to their programs to work directly with kids and families, but without necessarily having confidence in their own health insurance. So because of that, we decided to host a 2-part webinar series as we learned about some of the new benefits within that can help reduce the cost of health insurance that are within the American Rescue Plan. So about 3 weeks ago, we had a call with Sean Sheehan from the Department of Vermont Health Access, who walked us through what some of the upcoming changes are there and that we hope can make health insurance a lot more affordable. But we still know that this is a really complicated topic. And so we wanted to make sure that we could, that folks knew where to get their questions answered and be fully aware of what resources are available for you as early childhood educators, as employers, and then also as as folks that are working directly with families. So in doing some of that outreach, we connected with Alicia at Vermont Legal Aid and with the Office of the Vermont Healthcare Advocate. And I know we were exploring this topic with Let's Grow Kids as well. And we both, Luann Beninati and I were like, whoa, this is so interesting. And we did not realize this service was available and felt like it was really important for early educators to know about it. So that's why we're here tonight and really excited to have Alicia with us and really looking forward to hearing from you about the important work that you do and how that can support kids and families in Vermont. So, thank you.
Thank you so much, Janet. I thrilled to be here with you all tonight and have the opportunity to connect with you and tell you all a little bit about the Office of the Healthcare Advocate, in addition to some other interesting changes that are going to be making their way through Vermont Health Connect this month and in coming months as well. So yeah, just to get started, before I go into my PowerPoint, I'll introduce myself a little bit further. Again, Alicia Roderigue. I'm the communications coordinator with the Office of the Healthcare Advocate, which, as you mentioned, is a part of Vermont Legal Aid. And I've been working with Vermont Legal Aid for about 6 years now in a number of capacities. I started there actually as an AmeriCorps Vista member back in the day, and I did a lot of work around immigrants' rights and healthcare access at that time. I've spent over 2 years as an advocate on our healthcare advocacy team. So I worked with thousands of Vermonters to help them answer their questions related to health insurance and access to care. And now I'm the communications coordinator for that office. So I work to kind of align our advocacy initiatives with some policy initiatives as well. So I've gotten a lot of experience in that world, and I'm just so thrilled to have an opportunity to provide some really plain language information about some of the programs that are available through Vermont Health Connect and how you all may go about taking advantage of them. So what I'm going to do now is I'm just going to share my screen. I have a little presentation that I'll give for you all.
Thanks, Alicia. And I also wanted to offer that if folks have questions that they want to ask, please feel free to use the Q&A function down below in Zoom, and we can make sure that we get those answered. Or if you'd like to use the chat, that I think would work fine too.
Can you all see my screen right now?
Yes, we can see your screen. We can see the full, you see it not as like presentation view, but as the slides.
Great, I'm going to take that as
perfect. Thank you.
Thank you so much. So again, Alicia Roderigue, Office of the Healthcare Advocate. And what I'll start by doing today is just laying out a really brief agenda for you all. So the first item I'm going to talk about is the Office of the Healthcare Advocate, who we are and what we can do to help. Then I'm going to touch base on Dr. Dinosaur. Dr. Dinosaur is a Medicaid program through the state of Vermont, and that's a pretty comprehensive benefit that is either free or at low cost for certain income eligible Vermonters. And Dr. Dinosaur is particularly available to children under 19 and pregnant people. Then I'm going to very briefly talk about Vermont Health Connect and some of these ARPA changes. I understand that you all had a fantastic webinar on that about 3 weeks ago. And in the last portion of the presentation, I'm just going to kind of open up the floor to you all. Feel free to ask me questions, and I'll do my best to give answer to those questions based on my advocacy experience. If something's really in-depth and complex, I'll likely refer you to our helpline to just get connected with an advocate for confidential advice. But certainly, I'm happy to share any information I can tonight. Great. So to start, I'll give you a little bit of background about the HCA. The HCA is just the acronym that we use to describe our office instead of saying Office of the Healthcare Advocate all the time. So we were established by the Vermont legislature in 1998. And since that time, we've had an opportunity to work with and serve over 60,000 Vermonters, particularly folks who have issues related to health insurance and access to care. And our office is really unique because we have both an advocacy team that works directly with Vermonters and a policy team that does a lot more systemic advocacy on behalf of Vermonters, but is very much informed by the work that the advocacy team does. So the way that I would describe the advocacy team is they're essentially problem solvers. They're on the phone with Vermonters like yourself every day, trying to give advice, advocate on their behalf. It involves a lot of research, and occasionally we do represent Vermonters who are having a difficult time navigating Vermont Health Connect systems or Green Mountain Care Systems, which is the program that they use to refer to folks who are eligible for Medicaid and Medicare, in addition to another wealth of Green Mountain Care benefits that can really help folks who are enrolled in that Medicare benefit. And the way that we connect with Vermonters is primarily through our helpline. So what will happen is if somebody wants to connect with a member of our advocacy team and get that individual advice, they call our helpline, and what they'll do is they'll just leave a brief message. And what we prompt people to do is just leave their name, phone number, and a very brief description of the issue. The phone number to our helpline is 1-800-917-7787. And again, 1-800-917-7787. I always like repetition in these circumstances. And again, we typically call folks back in anywhere in between a day or 2 days. If you do have an urgent issue that's really time sensitive, we highly recommend leaving that detail in your message, just because we like to call the most urgent cases back first. And I'll get into a little bit more information about our policy team as well. So they work to advocate on behalf of Vermonters through the legislative process and the Green Mountain Care Board. So very specifically, they're a consumer voice in the hospital budget process, as well as insurance rate review processes as well. So again, the advocacy team and the policy team work together. The advocacy team does a lot of work on individual cases on behalf of Vermonters. And then we try to use the information that Vermonters present to us to advocate in a more systemic way through the legislature, through the Green Mountain Care Board, and a number of other policy-based resources. So yeah, it's a pretty encompassing process. We work with a lot of people, and again, there's no income limit to the services that we have. So we try to make ourselves pretty accessible to most Vermonters who have questions or concerns. And I just wanted to, provide a photo of what our team looks like. And I'll just give a shout out to a few folks this evening. Mike Fisher, this individual here in the blue, he is our chief healthcare advocate. He's been with us, I think, for about 5 years or so. And he was a state rep and served in the legislature prior to joining our team. He has a really strong social work background and actually worked within the early childhood education realm for quite a while too. And the other person I'll just point to today is Marge Stitchcomb. She's the individual in the back with the blonde hair. Marge is the supervising attorney for our helpline. So she just supervises our team of 8 advocates. And she has a wealth of knowledge from her, I think it's 12 to 13 years of experience working within these programs. So we have a lot of skilled and informed individuals on our team who are really dedicated to giving Vermonters answers to our really, really complex healthcare system. And something I always like to emphasize about Vermont Legal Aid, and specifically the Office of the Healthcare Advocate, is that we are an independent organization. So as I mentioned, we're a project of Vermont Legal Aid, which is a nonprofit law firm. We're not an insurance company. I am not trying to sell you anything whatsoever when you call our office and get connected to a member of our advocacy team. And we're not a part of state government either. We actually try to work with state government to resolve those problems externally. And again, as I said, sometimes we do represent in their appeal process as well to try to help navigate things on behalf of Vermonters. And again, what I will emphasize is we're a free resource. So anybody, regardless of your income, who has a question about health insurance or access to care, we are here to answer your questions. Our only requirement is that you have to be a Vermont resident to get service through our organization. Right. And again, 2 of our lovely advocates pictured here. Currently, the advocacy team is working remotely due to the COVID-19 pandemic, but the functionality of our office has not changed whatsoever during that time. We're able to help folks navigate the same systems we were when we were working at home as we were when we were working at our office. But we do plan to return to our office probably sometime in the late fall. Great. And now I just want to go into a little bit more in-depth information about the ways that we can help Vermonters who have these healthcare issues. So we divide our cases into some broad categories. The first I'll mention is what we consider access to care. So that may be somebody who goes to the pharmacy and is told by the pharmacist that, hey, your prescription medication is not covered by your insurance, or that, hey, unfortunately, your insurance is no longer, active. We don't have any way to bill this to your carrier. That's one example of an access to care case that we have helped navigate on behalf of many Vermonters. Something else that I think falls into this category would be if you're having an issue with a prior authorization for a specific procedure or to see a specific specialist. We're really good at reading the legal criteria for these prior authorizations and trying to guide you through that process. And, we even work with providers sometimes to explain some of the legal requirements in those prior authorization criteria. We also work on eligibility cases, and I would say that this accounts for the largest percentage of the cases that we take. So we're really well versed at helping people navigate eligibility for state and federal healthcare programs. And this could essentially be any sort of healthcare program that you have a question about, whether it's Medicaid for adults, Dr. Dinosaur coverage for a pregnant person or a child, qualified health plans through Vermont Health Connect and that plan selection process. And a big one that we also work on is individuals who are making that transition to Medicare and trying to get things in place because that can be really confusing and really complicated sometimes. So we just want to be that friendly resource who can try to break things down and explain things to people in plain language. And we're also really well versed at working with people who have specific issues with Medicare, whether that is an issue with their prescription drug coverage, or any of the parts that are in relation to Medicare, whether it would be A, B, or C. And again, that's too complicated to get in here now, but I just wanted to mention that so people knew we have that service available as well. We also do a lot of consumer education, so giving folks like yourself just information about the healthcare questions or concerns that may have. And that can look like anything from eligibility for subsidy through Vermont Health Connect to, that Part D as in drug enrollment process for Medicare. In the next category I'll mention are billing problems. So if you have a bill that you think was coded improperly, or if you're getting a large balance from a hospital or provider that you just think is inaccurate, or there was some other issue that you just want a second set of eyes to look at and kind of evaluate the merit of, we are always happy to try to answer questions and explain some of these more complex bills to people. We also answer questions in relation to the complaint process for particular providers or healthcare facilities. We're not the organization that actually answers and investigates those complaints, but we can give people information about what to expect from that process and the right people to talk to. And the last item that I'll touch base on is buying insurance. So this is really particularly related to qualified health plan through Vermont Health Connect and helping folks with that complicated plan selection process. However, we do help folks navigate that Medicare process too and evaluate whether a Part C plan would be the best for them. So all of our advocates have really years of experience helping people navigate these issues in addition to quite a few others. So if any of this comes up, please feel free to reach out to our office for free advice. One of our advocates would be really happy to connect with you and answer your questions. And now what I'll do is just tell you a little bit about how to get in contact with us. As I said before, the Office of the Healthcare Advocate can help any Vermonter who has questions or an issue with healthcare. There are no income screening guidelines. You don't have to make under a certain amount to be eligible for our services. And we have two ways that you can contact us. You can contact us over the phone. And again, you'll just leave a message with our intake system and we'll give you a call back as soon as we have an opportunity. Again, that number is 1-800-917-7787. Or if you're not somebody who likes to leave a message, we also have the option for you to do an online intake. And you can do that through our vermontlawhelp.org/health portal. And before we get into any really specific content about Dr. Dinosaur or ARPA, I just kind of wanted to open this up to the audience and see if you have any questions about the services our office can provide or the things that we may not provide. I just thought I'd open it up before I transition to a different topic.
I don't see any questions that have come in, so I think that's great, Alicia. Thank you.
Yeah, not a problem whatsoever. Great, so let's talk a little bit about Dr. Dinosaur today. So Dr. Dinosaur, let me get on the right slide. I apologize for that confusion. So Dr. Dinosaur is a really amazing free or low-cost healthcare benefit. So it's considered a type of Medicaid. And Medicaid is a program for which eligibility is based on your household size and household income. So that's certainly a factor when we talk about eligibility for this benefit. But Dr. Dinosaur specifically is for children and teens who are under the age of 19 or pregnant people. And again, eligibility for this benefit is just based on your household size and household income. And what I wanted to do, just for a quick reference, just because I don't like to use FPLs whatsoever in my explanation, because I find that often people really don't know what that means. So instead of throwing up numbers like 208% of the federal poverty line with a 5% disregard, I'll just throw this chart up here. So for example, if I am a household that consists of myself, my husband, and a child, and we're looking into evaluating whether or not our child would be eligible for Dr. Dinosaur coverage, I would take a look at this chart. We'd be considered a household of 3, and I'd go under the children under 19 category. And income eligibility for this program is based on monthly income. So our household income would have to be at or below $5,801.50 per month. And again, you can kind of explore this and take a look at the numbers that would be applicable for your household as well. And what I'll also do is I'll give an example that's specific to pregnancy as well, just because they look at household size slightly differently in this circumstance. So let's give that same example again. Say that my household consists of myself, my husband, 1 child. And in addition to that, in this example, let's say that I'm expecting a child. The household size in that circumstance would actually be a household of 4 because they count that unborn child within your household. So as a quick reference, what I would do, I would look at a household of 4, and then I would take a look at that income. So in order for my household to be eligible for Dr. Dinosaur for pregnancy, we would have to make at or below $4,704.45 per month. And of course, if there's ever any eligibility questions related to this program, I highly recommend that people get in touch with our office, because sometimes there is really specific advice that we can give folks in relation to lowering your taxable income to get under those thresholds if you're very, very close and interested in exploring that benefit. And again, I just know that they can be really valuable. It's really valuable coverage, and it's very comprehensive as well. So I just always like to emphasize the benefits of Dr. Dinosaur. Both programs for children and for pregnant people have dental coverage. For children, you're able to get an eye exam in addition to glasses. You're able to get an eye exam if you're a pregnant person as well. And there are also very low $1 to $2 copays for prescription medications under this program. So again, if you fall within that category, if you have children under 19 in your household, or if you're a pregnant person, I always recommend just looking into evaluating eligibility for this program.
Alicia, for some reason your sound was getting a little harder to hear for me, at least. I wonder if you're getting a little farther away from your microphone, maybe. And then, if somebody is pregnant, or somebody is talking to a parent within their program, right, and they know that as an adult they didn't qualify, or as a family they weren't qualifying, but their children were qualifying, when they might tell an early educator that they are expecting a child, because early educators are often the first to know, right? They should. Then that would potentially be a moment to, and we would be advising them to look into Vermont Health Connect at that moment, or into Dr. Dinosaur at that moment. Which would the advice be?
Yeah, certainly. Is the sound a little bit better now?
It is a little better now. Yeah, thank you.
I'm glad to hear that. Sorry about those audio problems a short time ago. So the way that you go about applying for Dr. Dinosaur coverage is actually through Vermont Health.
Okay.
And you can do that through their website, or you're able to call them and fill out an application over the phone. So that's just really dependent as to what's more accessible for the person who's looking to apply. And
Okay.
and even if you, before you start the application process, if you just like to get a little bit of consumer education about the program, our office, the Office of the Healthcare Advocate, would be more than happy to talk to you about these options and take you through what that eligibility process is. Great. And something else that I like to emphasize about the Dr. Dinosaur program is that you can apply anytime. Unlike qualified health plans through Vermont Health Connect, there's no open enrollment period. As long as you're eligible, you're able to just fill out that application, or even if you're ineligible, you'll just get that denial, unfortunately. But again, just fill out that application at any time and they'll send you an eligibility determination. And something else that's important is as long as your household income remains within the eligibility criteria, children under 19 can really stay on Dr. Dinosaur until the last day of their birth month when they turn 19. So this is a program that can really follow children from childhood to being teenagers as well. And it's can be certainly more affordable than, say, adding a child onto a family plan, for example. For some higher income folks, there can be a small $30 to $60 premium for this type of coverage. However, between the vision insurance and the dental benefit, it's something that's really, really beneficial. So I'd highly recommend evaluating those options if you are income eligible for that program. And then just one note in relation to Dr. Dinosaur for pregnancy. So Dr. Dinosaur for pregnancy will last through the duration of your pregnancy. And then you'll also have that coverage for 60 days after the baby is born. So there's a little bit of postpartum coverage in there as well. And what will happen is Vermont Health Connect will typically send you a notice stating that your coverage is going to close after that 60-day postpartum period. And if you are ever in a situation where your coverage is closing through Dr. Dinosaur and you want to evaluate what your health insurance options are after that, again, the Office of the Healthcare Advocate can be a really great resource to help you navigate that process. Great. So that was a lot of information about Dr. Dinosaur. Again, I just wanted to pause and see if anybody had any Dr. Dinosaur specific questions before I move on and briefly talk about ARPA and Vermont Health Connect. Great, wonderful. So I will just move on. So I know you all had a fantastic presentation from Sean Sheehan from Vermont Health Connect and DEVA, the Department of Vermont Health Access. So I'm not going to go too in depth on this topic tonight, but whenever I'm doing a presentation like this or just out in the community, I always like to just advertise some of the benefits that will soon be available to Vermont Health Connect enrollees through this recent federal law that was signed in March of this year. So currently, what I think is really exciting about Vermont Health Connect is they're offering a special enrollment period for Vermonters who are uninsured until October of 2021, so this year. So unlike in the past, when the only time that you could sign up for health insurance was from November to December 15th, right now, any uninsured Vermonter is able to sign up for health insurance through Vermont Health Connect until October. And that wasn't something that was directly a result of ARPA, but it did come as a result of the COVID-19 pandemic and obviously our state just trying to put forth insurance opportunities for folks who may be in desperate need during that crisis. So something else that I'm also really excited about is that Vermont Health Connect, because of this new ARPA law, they're going to have expanded subsidies for all Vermont Health Connect enrollees. And when I talk about expanded subsidies, I mean particularly premium assistance. And this premium assistance is something called advanced premium tax credit. And that's a tax credit that you get in advance to help pay for the cost of your monthly health insurance premiums. So it makes that monthly premium a little bit more affordable. And that's always been something that's been available to Vermont Health Connect enrollees. And eligibility for that benefit is just based on your household size and household income. However, because of this new federal law, they've expanded the amount of advanced premium tax credits that all enrollees will be eligible for. And based on our last correspondence with Sean and Vermont Health Connect, it does appear that if you're currently enrolled in the individual marketplace through Vermont Health Connect, that they're going to be sending you an eligibility letter for those advanced premium tax credits and that subsidy expansion, probably around June 14th or so. You may not get it in the mail until around June 21st, but that letter should really give you some detailed information about how much expanded subsidy you should be eligible for. And at that time, in addition to getting that expanded eligibility, you may also have the opportunity to change your plan. So again, you will get a special enrollment period based on that new eligibility for subsidy. And if you'd like, you'll also have the opportunity to evaluate whether or not your current health plan is what's going to work best for your healthcare needs and your financial needs in light of some of these new subsidies that are available. And when you've made that decision, you just have to call Vermont Health Connect and tell them how much subsidy you're interested in applying to your account and if you'd like to change plans during that process as well. And again, that process, I imagine, is going to be very complicated for a lot of people. So I just always want to plug that our office is here to help you and give you support, whether it be through the questions about advanced premium tax credit or even the plan selection process. I know that corresponding with state agencies can feel complicated sometimes, and we just want to try to make that as painless as possible for you all. And one last kind of ARPA Vermont Health Connect shout out that I'm going to get is there are really strongly expanded subsidies and cost sharing reductions for Vermonters who have received unemployment insurance in 2021 and don't have another offer of insurance, whether that be employer-sponsored insurance or Medicaid or Medicare. This subsidy eligibility is particularly for people who need to buy their plans off of Vermont Health Connect in that marketplace. And something that's really exciting about that is you don't need to currently be on unemployment insurance. You just have to have received it at some point in 2021 to be able to take advantage of that benefit. And what that does is essentially it puts your income at the lowest possible amount to receive the maximum amount of advanced premium tax credit, so the maximum amount of premium assistance, in addition to the maximum amount of cost sharing assistance that's available through Vermont Health Connect. And to define that term, cost sharing reduction or cost sharing assistance, that is essentially a form of assistance that you can get to help you pay your out-of-pocket costs when it comes to healthcare. So if you go to a doctor and have a copay, cost sharing assistance can help lower that amount for your copay. And that also applies to deductibles as well. Yeah, so again, individuals who were on unemployment insurance this year, I really highly recommend taking a look at Vermont Health Connect. And if you're currently uninsured, you will have an opportunity through that special enrollment period to sign up and take advantage of that benefit. And what all of this means is that buying health insurance through Vermont Health Connect is really more affordable than it has been in the past few years. If it was too expensive in the past and you're currently uninsured or don't have an offer of employer-sponsored insurance, it may be a really good time for you to reevaluate your options and look and see if there's a plan that's actually affordable for you and can meet some of your healthcare needs as well. And again, I'll give a plug for our office in this process. We are more than happy to talk you through this option if you'd like. Great. And again, this slide just details some of the help that we can offer people in these circumstances. We can give you consumer education about how ARPA is going to help your healthcare benefits. We can advise you on plan selection and eligibility for advanced premium tax credit. And if you're having some sort of issue in this process, we can also intervene and call Vermont Health Connect on your behalf with your permission. And that is all the presentation that I have for you all this afternoon, or this evening, actually. I apologize, interesting transition to my day into evening. But again, I'm just going to leave a plug for our hotline. You can reach us at 1-800-917-7787. I also have the link to our website up, vtlawhelp.org/health. And I've put my email address and my phone number on here as well if anybody wants to follow up with any questions or concerns that they may have. Again, I would be happy to connect you with a member of our advocacy team if you do have a particular case question you'd like to get individual and confidential advice on.
Thank you, Alicia. We, for folks who are listening, if you want to enter a question into the Q&A or the chat, please do so. But we also collected a couple questions in advance. And I'm curious if your office can give advice related to health savings accounts as well, if there's a health savings account associated with the plan that they're choosing.
Yeah, absolutely. So what I will say about health savings account is that you can only open a health savings account or an HSA with a particular HSA compliant plan. And often the way that you know that something's an HSA compliant plan is you would, if you're using the Vermont Health Connect plan selection tool, usually there's an abbreviation called HDHP, High Deductible Health Plan. And that gives you a good indication, obviously, if it's an HSA compliant plan. And what would happen in that circumstance is you would, if you were interested in signing up for that HSA compliant plan, you would enroll in that plan. And after that had happened, you'd have the option of opening up that HSA account. And some individuals, there are a number of people that administer HSAs. What I often advise clients to do in most circumstances is there are some local credit unions or, smaller banks that offer lower cost HSAs to folks. So certainly exploring those options can be really, really helpful. And an HSA is a really wonderful way for you to be able to save for whatever healthcare needs come up in the future. HSAs cannot pay for your healthcare premiums. However, they can obviously be used to help afford the cost of going to the doctor. So if you have a deductible or a copay that's really large, those HSAs can be really valuable, and that balance can roll over on an annual basis as well. So it's a great way to, work financially to meet your healthcare needs and, potentially have a little savings for the future.
Thanks, Alicia. We also had a question about asking, where can we look to get health insurance for our employees? And this person specifically had a program that has employees that are in New Hampshire and in Vermont. And this might be a little out of scope for the work that you do, but I thought maybe you could speak to it.
Of course, yeah, I would be more than happy to just give some basic information about this. So our office, we don't really advise businesses on what plan is the best to choose or how that program will work. Oftentimes getting a broker, I think usually through your local chamber of commerce, they often have really good recommendations, would be the best step in that regard. However, I can give some basic information about potential options that you could explore as first steps. So it sounds like you would potentially be looking into what's referred to as small group coverage. And a first step to just check on price comparisons would be reaching out to the carriers that are available. In Vermont specifically, we have two carriers. We have Blue Cross Blue Shield of Vermont, and we have NVP. And as somebody who has employees in both New Hampshire and Vermont, one thing that I would just talk to them about during those phone calls is what their network looks like in both states. Do they have an adequate amount of providers in both Vermont and New Hampshire? And that may really inform what carrier that you would want to go with within that process. And again, they would be a good place to just reach out and evaluate some of those options. What I will say, and this is not trying to caution anybody from offering employer-sponsored insurance, but one point of clarification that I like to give to people is that individuals are not eligible to receive premium assistance, so that advanced premium tax credit, through Vermont Health Connect's individual marketplace if they have what's considered an affordable offer of health insurance that meets minimal essential standards. So as an employer, I just like to caution people to really think about, is the insurance that I'm trying to offer to my employees something that's going to be helpful and beneficial to them, or would potentially not offering insurance and looking into the subsidies that that individual could get on the individual marketplace be something that's a little bit more cost effective from them. Again, I'm not coming at that from a broker perspective. That's just some of the situations I've seen in my experience on the advocacy team, where they may have an offer of employer-sponsored insurance that has a really high deductible, and the individual marketplace through Vermont Health Connect may be a better choice for somebody. But again, that's all dependent on their individual financial situations and their household size. So it's really complicated, and I really wish you the best of luck navigating that process.
Thank you, Alicia. I don't see any other questions at this point, so I think this was really helpful. I have learned so much about health insurance in the, from you and in the last call as well, and I'm really excited that it looks like there's some additional opportunities for people to be able to get their health insurance needs met in the affordable way, and really excited to know about your office and the support that you can provide to early childhood educators, and also to for themselves and for their their colleagues, their employees, but also for the families that they serve, who do often trust and confide in early childhood educators around some of the struggles they're having. And I think the services you provide can be a great resource. So I really appreciate you taking the time to be with us tonight, and to keep Vermont's early childhood education community informed and up to speed. So.
Absolutely, yeah. Presentations like these, where I get to connect with folks, are really probably one of my favorite aspects of my job. So thank you so much for having me tonight. One plug, or actually two plugs, that I will give before we officially sign off, is that my office is hosting a town hall. So a situation where we're going to give a brief presentation and give folks an opportunity to ask questions specifically related to ARPA and Vermont Health Connect on June 27th. So check into the Vermont Legal Aid Facebook page if you're interested in joining that. And I'm also going to be releasing some 5 to 10 minute explainer videos on different components of ARPA and how it can impact certain groups of people as well. So if any of you are interested in getting more information on that, that's going to be available through the website that I had mentioned a little bit earlier, vtlawhelp.org/health, in addition to the Vermont Legal Aid Facebook page.
Great. Thanks so much, Alicia. We'll make sure that we share those opportunities with our membership more broadly as well. So thank you so much.
Of course. Thank you all.
We appreciate it. Have a great night. Thanks.